Lemire.
Johns, please, for 6 minutes.
First, I want to thank all of the witnesses for their important testimony and the important work that they all do. We heard from the Chief Coroner of British Columbia, Bonnie Henry, Dr. Henry. You're the Chief Medical Officer of British Columbia, the BC Chiefs of Police, and the Canadian Association of Police Chiefs, the First Nations Health Authority in British Columbia, and the BC First Nations Justice Council, as well as the Health Canada Expert Task Force, all saying that this is a complex issue that requires a comprehensive response. And every single organization and individual I listed there was clear that we need to replace the toxic street supply with a safer supply of substances, to stop criminalizing people who use substances, create a system with treatment on demand, invest heavily in recovery, prevention, and education. Dr. Henry, we just had the decriminalization model in British Columbia come into effect in January of 2023. And the month prior, the death rate per 100,000 per day, was 7.5. The last 2 months, the death rate dropped to 6.1 and 6.2. Do you believe that the decriminalization trial in British Columbia is working and has been working?
Thank you for that question. And you're absolutely right. We need to focus on what this is. It's one of a suite that we have heard is necessary. And the decriminalization of people, and that's the important thing. It is about removing criminal penalties for possession of small amounts of controlled substances. It is not legalization, and it is not a free pass to violent or threatening behavior. And it is not the sole solution. It's one important tool to help for a couple of reasons. One is the people who are visible to police, and we see that, and that is what a lot of the focus is on. People who it's uncomfortable for us to see people who are on the street, who are homeless, who don't have a safe place to go to use their drugs or to connect with people. But it also is important for those who are not visible, who are also dying, and we've heard that this morning. Young people who are maybe experimenting or occasional users, the young man who's working in the trades, whose family I hear from all the time, didn't know that he was using drugs again or didn't know that they had relapsed because of the shame and stigma and fear of a criminal record that keeps people from talking about their drug use and reaching out for help. So in that sense, yes, the decriminalization of people here in British Columbia has leveled the playing field across the province so that it's not discretionary about who gets their drugs seized, who gets a criminal record. And we've seen that. We've seen that in the statistics on drug seizures and on charges for people who use drugs.